Hi, this video is the hair transplant restoration surgery on a black African American man who has a receding hairline and temple as well. And so I'll go to bring down the hairline for him. On average, from the eyebrow to the hairline, from the mid eyebrow to the mid hairline is around 6.5 to 7 centimeter for black and Asian. Caucasian is around 7.5 to 8.5 centimeter. For this client, we end up got 6.5 centimeter. There's other anatomical landmark which we can find when you frown the highest crease, and you put a finger breadth above it and you follow that, and that's where it is. Then from the midpoint to the temple is around 7.5 to 9 centimeter. This client actually from here to here is 8 centimeter. From here to here is 8 centimeter, and from the midpoint to here is around 6.5 centimeter. So I'm very precise how when I do the measurement. For Asian and Caucasian, it's a little bit arch up more, and then for black men, it's almost a curve up, slightly up, but almost straight across. For Caucasian, kind of arch back. If you can see on the temple, his is like a crescent, and because he's not only losing hair up but on the side, so I'll go to have it more straight perpendicular. And for other ethnic, the temple is important, but for black, it's very, very important because it really frames the face better. And once you bring it frames the face much better and allow you to wear your hair. And then we will be harvesting by the FUE method using FUE to harvest around 2,500 grafts. And with 2,500 grafts, we not only built this band, but we're filling the temple as well. If we don't work on the temple, then we can go half of the head. So unfortunately, we had to work on the temple, so we take some of those hair and put in here. But it's a really nice band. It's like 1.5 to 2 inch in the front. FUE is Follicular Unit of Extraction, and it's the most advanced technology available. FUE leaves you tiny dots of scar, allow you to wear your hair shorter. As you know, I'm one of the very few surgeons who specialize in the art of restoring black curly hair using the FUE method. With my invention, the DFC technique. DFC stands for my last name, and Diep FUE Curve technique. I invented for a few years ago, and basically it predicts where the curly root lies underneath the scalp and go in at a precise angle and harvest it out. Because where the hair exits, the root could lie to the left or right or any position, and that's why it makes it very difficult to find a surgeon who can specialize in harvest black curly root out. There's a other instrument machine out there called the robots, the Gatos or the neograph. Those cannot harvest black curly hair, and they kill most of the graft. So once we get the shape down, we will. Before we go further, with the FUE, most black men prefer because it leaves you thousands of dots of scar, but it's so small and so scattered that allow you to shave your head shorter than this, sometimes to 1 or 2. It just depends, but it does leave scar, so no surgery without scar. But the FUE scar is less visible and more preferred. But it's not just less visible scar when you compare to a strip method, but it's less invasive, less bleeding, less chance of infection. We leave the scalp intact, we just pull one head at a time. The strip method is not preferred by black men, even though some doctors are trying to say, they won't see it, but they will. I mean, there's a linear scar running from one ear to another ear. Unless you leave your hair in an afro, then you can hide it, but if you cut it short, they can see it. And the nature of the black depends on some black curly hair, but some of the black curly hair will curl away from the scar. It will enhance it further and reveal it further. So most black men prefer the FUE, not the strip method. And this is the art of hair transplant. And then once we get the shape down, we will zigzag this. Now, for black, zigzag is smaller in amplitude versus Asian or Caucasian that have bigger in amplitude. Why? Because most black men, if you're small in amplitude, they like to line their hair up anyway, but you have such a big zigzag that the hairline will be higher when you line it up. And then the angle is flat against the skin, more around 15 degrees versus Asian around 35, 45 in the front. And then it change when you go a different direction. Not only the precise angle is important, the selection of hair graft is important. We transplant rows and rows, single hair graft in the front, followed by regular 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The goal in the front is for softness and naturalness. The goal in the back for volume and density. I'm very excited for this gentleman here because his look will completely change next year when he has a full set of hair and lower set of hairline. Thank you.